Cranial nerve 1 olfactory nerve asks your client to identify at least 2 substances such as coffee. Cranial nerve 2 asks the client to read a newspaper or magazine paragraph to assess nerve vision. View the retina and optic disc of each eye. Cranial 3, 4, 6 inspect the eyelid of each eye. Assess extraocular movement. Then assess pupillary response to light. Cranial nerve 5 asks the client to close his eyes and then touch him with whips of cotton of his head, cheek, and jaw on each side. Test pain perception by touching the tip to safety pin to the same 3 areas.
Cranial nerve 7 or facial nerve asks the client to smile, frown, and wrinkle forehead, show teeth, puff out cheeks, raise eyebrows, close eyes tightly against resistance. Cranial nerve 8, acoustic nerve or in the sense of hearing. To assess this nerve for the Weber's test, strike a tuning fork lightly against your hand and place the vibrating fork on your patient's forehead at the midline or on top of his head. Ryan's test, strike the tuning fork against your hand and place the vibrating fork over his mastoid process. Cranial nerve 9 and cranial nerve 10, the glossopharyngeal nerve and vagus nerves. Test these nerves together because their innervation overlaps in the pharynx. Listen to your patient's voice, then check his gut reflex by touching the tip of a tongue blade against his posterior pharynx and asking him to open wide and say ah. Watch for symmetrical upward movement of the soft palate and uvula and for the midline position of the uvula. Cranial nerve 11 or the spinal accessory nerve. Assess this nerve by testing the strength of the sternocleidomastoid muscles and the upper portion of the trapezius muscles. Ask the client to turn head against resistance, first to the right, then to the left. Cranial nerve 12 or the hypoglossal nerve. Observe your patient's tongue for symmetry. Her tongue should be midline without tremors or muscles twitching. Test tongue strength by asking her to push his tongue against her cheek as you apply resistance.
And I will be doing the neuro assessment and the muscle. And first things first, I will be doing biceps, triceps, and deltoid. Biceps, I will try to put force on my father's biceps. 1, 2, 3, 4, 5. And then, baba mo na daddy. Tapos, ang sunod is supination. Supination is, I will try to twist it from supination to pronation. And he will try to resist. Malakas, hindi kaya ma-twist. Can you raise your arms towards the ceiling and can you bend it and extend it and can you move your finger. I will try to put force and you try to resist it. 1, 2, 3, 4, 5. And then can you relax mo. Kung wala siyang resistance, pagka ganyan is bigla siyang bababa. Kung wala siyang resistance, you need to be relaxed. You try to resist as I put pressure. 1, 2, 3, 4, 5. Then lateral deltoid is the next. You try to resist as I put pressure in your deltoid muscle. 1, 2, 3, 4, 5. Then, in posterior deltoid naman, patalikod. Raise in 90 degrees. Tapos, you try to resist as I put pressure on your deltoid muscle in 1, 2, 3, 4, 5.
The next to demonstrate is the testing of muscle stretch reflexes, including bicep, tricep, the knee, the ankle, and the plantar reflexes. So first, we need to demonstrate is the bicep. So the nursing head-to-toe assessment po includes the deep tendon reflex examination of the biceps tendon, including the C5 to C6 with using a reflex hammer. So I will show you how to properly elicit a response in the biceps tendon by finding the tendon in the antecubital fossa area of the elbow. So unexpected, the response of the bicep tendon is the contraction of the bicep muscle and flexion of the forearm. So I will show you how to demonstrate the response in the biceps tendon po. So ito po yung location. And next to demonstrate naman po is the tricep. So next, the depth tendon reflex examination of the tricep tendon is the C7 to C8. So with the reflex hammer. So I will show you to how properly elicit a response in the tricep tendon by finding the tendon of the back to the upper arm. So they're located below the tricep muscles, just to above the elbow. So to find the tricep tendons, it is best to have the patient extend the elbow, which make the the deep tendon more prominent. So unexpected response po dito is of the tricep tendon is the extension of the forearm and the construction of the tricep muscle po. So ganito po siya. So next to demonstrate naman po is the knee. So the patellar reflex of the test for the head-to-toe assessment that includes the deep tendon reflex examination of the patellar tendon located at the L2 to L4 with the reflex hammer po. So I will show you how to properly elicit a response in the patellar tendon by finding the tendon below the knee. So this is the best done by extending the knee, which will cause the patellar tendon to become more pronounced. So unexpected response of the knee reflex examination is the lower leg. So next to demonstrate is the ankle. So the Achilles heel reflex test that includes the deep tendon reflex examination of the Achilles tendon located at L5 to S2 with a reflex hammer. So I will show you how to properly elicit a response in the Achilles tendon by finding the tendon above the heel of the foot. So this is done by dorsiflexing first the foot, which will cause the Achilles tendon to become more pronounced. So, unexpected response po dito is of the Achilles reflex examination is plantar flexion of the foot. So first, you need to dorsiflex po muna yung foot. And then, using a reflex hammer is... So last to demonstrate is the plantar reflexes. So the plantar reflexes is the testing of the Babinski reflex, which is the plantar reflex nga po. For a Babinski sign, that is positive or abnormal, and the normal during the head-to-toe neuro assessment. So the Babinski sign that is positive or abnormal will elicit dorsiflexion of the foot. So a Babinski sign reflex in a baby will show a positive Babinski sign. So if the child is less than, if a child is less than 24 months of age, which will be dorsiflexion and fanning the toes of the negative Babinski sign in normal in patients older than 24 months, will elicit plantar flexion and curling of the toes.
For the assessment of sensory system for light, touch, pain, and vibration, ask the client to close both eyes and tell you what the client feel and where she feel. To test the pain sensation, use blunt or sharp ends of a paper clip. For the rind test, place the base of a struck tuning fork on the mastoid bone behind the ear. Have the patient indicate when sound is no longer heard. Then move fork or the held at base beside the ear and ask if now audible. Then for the Romberg's test, ask the client to close her eyes, then ask the client to stand erect with arms at the side and feet together, then note any unsteadiness and swaying.
Good morning, ma'am. I'm Danica Gaspar, your nurse for today. So ngayon po, iti-test po natin yung coordinations nyo. So first test po is yung rapid alternating movements po. So ma'am, kagayahin niyo po yung gagawin ko. Ganito po yung kamay nyo. Then kabila. Then yung kabila naman po. Then yung kamay nyo po, ilagay nyo po sa legs nyo, ma'am. Yung isa lang po. Then ulit-ulit din po. Then sa kabila po. Yung next naman po is yung finger nose finger test. So itong finger ko po, ay po-point nyo gamit yung finger nyo, ma'am. So sa isang finger po muna. Then sa nose po. Finger, nose, ulit-ulit lang po. Then kabila naman po kamay. So for heel knee shin po, ma'am, first step po is hihiga po kayo, then itatap nyo po yung knee nyo gamit po yung heel ng isang paa nyo po.
Observe the patient getting up from a seated position. If do they stand with equal weight on both feet. Ask the patient to look straight ahead with the arms on their side and then stand on one leg. Ask client to walk normally on a straight line. Test tandem gait by asking the client to walk a straight line while touching the heel of one foot to the toe of the other with each step. This is what you call heel to toes fashion. Turn should also be observed closely. Perform Romberg's test. Ask the client to stand erect with arms at the side and feet together. Note any unsteadiness and swaying. Then with same body position and feet together, ask client to close eyes for 20 seconds and again note for imbalance and swaying.